Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be studying about the CNS trauma. And this topic is basically asked as a short note. So you have to study this topic in that manner. Let's start. So the CNS trauma is basically a trauma to your brain or to your spinal cord. CNS trauma is basically a trauma that occurs to your brain and spinal cord. And in your surgery, you will learn that when we deal with the patient of trauma, you have a special system for that called as the triage system. Okay, called as the triage system that you will learn in your surgery lectures. So, when there is head injury, 50% of the cases are due to the traumatic death. Okay. Head injury basically contributes to the 50% of the traumatic death. And we have seen when there is an increased risk or increased cases of RTA, that are your road traffic accident. So if a patient is suffering from a road traffic accident, there are 50% chances that the person will be dead. Okay. And you know what, I have personally seen a case of RTA and after 10 to 15 days that person was dead. So it is that dangerous. So it's very advisable, if you are driving a two-wheeler, then please wear your helmets. Okay. And if you are driving a four-wheeler, then you need to wear your seat belts. Okay. Next, what is the mechanism? There is direct injury, like see, the person is going on a road trip, not wearing the helmet, met with an accident. What happens? Mechanical injury to brain. After that, what will happen? There will be ischemia. And you know what? When there will be ischemia to all the part of the brain, what will happen? The person will land up to brain dead and it will be declared as a brain dead patient. Okay. Very dangerous, guys. Please wear your helmets and wear your seat belts, right? Because it's not at all good for your family as well. So next we have the types of CNS trauma. Types. What are the types you have? Closed, then you have the open, and then you have the spinal cord. In the closed, what happens is there is no breach in the dura layer. You have some layers in your brain, so this dura layer is not getting breached. In the open one, what happens is the skull and dura are basically getting torn, are basically getting ruptured, are basically getting disrupted. Okay. Then you have the spinal cord that we will discuss in details. So closed injury are nothing but there is no breach in the dura layer, but parenchymal breach is there. In the open head injury, the skull and the duras are torn and there is a high risk of infection. Obviously, if your skull and your dura are exposed to the environment and the environment is so dirty, what will happen? You will be getting infection. Your brain will be so prone to developing infections, right? Next, let's see the skull fractures. Before jumping onto the skull fractures, let's just see a diagram over here. The first thing that you have is the linear fracture. Are you able to appreciate that it is like a Y-shaped? Okay, it's like a straight line. So linear, line. Okay, linear, the word is only signifies that there is a line. So there is a line of fracture that is there. Then you have a depressed fracture, just like your life, just like you guys are depressed, right? So the fracture is also depressed. So like you have, this is your skull and here you will be having so many breaks. This is nothing but your depressed fracture. Okay. Then you have the diastatic fracture. You are able to appreciate that the fracture is in between the two bones and the name is also suggesting diastatic. Dia means two. So the fracture is in between the two bones. Okay. Then you have is the basilar, base, that is on the base of the skull. See, this is the fracture that you have on the base of the skull. Linear fractures are the most common one and they are usually benign. Diffuse fractures are inward and cortical laceration is there. We will learn about the laceration. Then you have basilar fracture, that is on the base of your skull. You have a sign called as periorbital 𝗖𝗵𝗄𝗃, that is nothing but your raccoon's eye. See, this is like the eye, and around that eye you will be having a lot and lot of black, okay? Just like these are your raccoon eye. Just like you guys, when the exam is nearby, okay, and your exam is in 1 month, so what you will do, you will become a night owl. You will study till late night from 11 to 5 in the morning, but you only study 1 hour. That from 1 a.m. to 5 a.m. you are just pretending that you are studying, but you are not studying, right? So don't pretend, otherwise you will become a raccoon. You will be start developing this round dark circles, very dark, okay? Next, then you have something called as a battle sign. What is battle sign? In this only, behind your ears, you will be able to appreciate that there is some red thing, red bruise will be there. There will be, I'll write, there will be red bruise, okay? That will be there. That is called as your battle sign, okay? It's like someone has beaten you there. Next, let's just move on to the brain parenchymal injuries. So what you need to understand here, you have something called as a concussion and you have something called as the contusion, okay? These are the two things. So in the concussion, what is happening, right? I'll explain you. Like you are driving not you. Let's suppose someone is driving a motorcycle. He is not wearing a helmet and he, when he was driving, he lost his control, okay? After that, what happened was, in front of him there was a wall, and since there was no brake in his motorcycle, or he just lost the control, so he got smashed with that wall. What will happen? First is head will get smashed, okay? First thing, see this. First thing, there will be head will get smashed. After that, when he will work up this, the back side of your head also get smashed, okay? So like have you seen in the ads, they show a jelly, and when you just tap that jelly, it moves forward and then backward, to and fro movement, right? So the to and fro movement, is nothing but your concussion, okay? So let's see what's happening in the concussion. You have a reversible altered brain function, right? The pathogenesis, there is mechanical disruption of the RAS in the brainstem. Then there is sudden LOC without the structural damage. What is the LOC? Means line of control, okay? Then you have the clinical features. There, first one is the transient LOC. Then is amnesia. You have two types of amnesia, retrograde amnesia and the anterograde. In the retrograde amnesia, retro means backwards. So the patient is not able to recover the events that has occurred in the past. And anterograde, the patient is not able to recall the movements that has happened just 10 to 15 minutes earlier, okay? Next you have, the person will have confusion, dizziness, headache and vomiting. In the pathology, there is no gross image that will be seen. Complication will be post-concussion syndromes like persistent headache will be there, obviously, because there was a to and fro motion of the head. Obviously, the person will have headache, right? There will be dizziness and there will be poor memory because the person will not be able to recall that much. This is the image of the contusion. You are able to see a blue, so much. It's like a blue ink which has got deposited in your brain, right? So remember, if they will give you this figure in your spotting, then please be able to identify that, right? So contusions are nothing but the brain bruises, BB, okay? They are the BB, brain bruises. What is the mechanism? First thing is there is blunt trauma. Like someone has beaten you with the help of a bat so badly in your head that your brain has got injured, and as a result of the injury there will be bruises that will occur in your brain, right? The sites are mainly the gyri near the ridges. See, these are your ridges. These are your ridges. So the bruises near the ridges, right? Then you have something called as a coup and the counter coup. Okay, that the phenomenon of coup and counter coup I have explained you above. Okay, that is nothing but coup and the counter coup. In the gross pathology, you are able to appreciate their wedge-shaped and hemorrhagic lesions. In the microscopy, you are able to appreciate there is hemorrhage, necrosis, and gliosis. Gliosis is nothing but this scar. Okay, next that you have is the laceration. What is laceration? Laceration is nothing but the penetrating trauma or the depressed fracture. It is like how I'll explain you with the help of an example. Like you are just driving a cycle. Okay, riding a cycle, not driving, sorry. You are just riding a cycle. Then what happened? You fall down from that cycle and then you will have some bruises, right? Something like this. Okay, so these are nothing but your lacerations. Then the features are it is irreversible neuronal damage and necrosis will be there in your, if this occurs in your brain, then obviously it will be irreversible and there will be necrosis, because in brain how will you able to manage that, right? If this same thing occurs in your hand or somewhere else, you will be able to manage it, you will be able to take all the antiseptic precautions, but if that occurs in your brain, how you will be able to manage that, right? So the management is very, very difficult. The risk is only there will be secondary infections, and infections are very, very common to your brain injuries, and if the infection will occur, your brain will land up into the meningitis and then there will be brain death. Okay, next that you have is the diffuse axonal injury. What is diffuse axonal injury? So there is a mechanism of acceleration and deceleration. The sites are basically corpus callosum and the parasagittal white matter, right? So your brain gets smashed into that wall, then what will happen? There will be axon shearing that will happen. What are the clinical features you will have? You will have immediate unconsciousness after the trauma. The patient, like you have something called as a Glasgow coma scale, the GCS scale. Okay, in the GCS scale, when you will take all the parameters of the GCS Glasgow coma scales, you will be able to appreciate that the patient is not at all conscious and he is not oriented to time, place and person. Okay, next, in the pathology, in the microscopy, you will be able to appreciate something called as the axonal retraction wall, and this will be asked as your MCQ in your university exam. Okay, next you have is the vascular injuries in trauma. They are very important. They will be asked as a short note. Okay, the first one that you have is your epidural hemorrhage. Epidural hemorrhage. See this radiological figure. Are you able to appreciate? It is like a idli shaped. It is like a idli shaped, right? What happening here is there is a fracture to the temporal bone. Then there will be rupture to the middle meningeal artery. There will be rupture to the middle meningeal artery. And after the rupture, there will be the bleeding. There will be bleeding in between the skull and the dura. So this white is nothing but your bleeding. This white is nothing but your bleeding. Okay. Then you have something called as a lucid interval. Now what is lucid interval? Lucid interval basically occurs in your EDH. What happens is there will be like the person met with an accident and after some time he will become unconscious. Then after 10 to 15 minutes, that person will become conscious and he will be oriented to time, place and person. And after 10 to 15 minutes, he again become unconscious. So, lucid interval is nothing but the time period in between the person is conscious, then he become unconscious, then he become conscious. Okay. Conscious, unconscious, conscious. In the CT, you are able to appreciate there will be biconvex, that is the lentiform, and the complication is herniation will be there. Treatment, there will be neurological emergency we will burr the hole and evacuate. Okay. Next that you need to understand is about the SDH. Now in the SDH, what you have? SDH is nothing but when there is rupture of bridging vein between the brain and the dura. See, these are your brains, these are your veins which basically get ruptured. Okay, these are your veins which basically get ruptured. So the risk factors are basically it occurs in your elderly and alcoholics and infants. In infant, it is called as a shaken baby syndrome. In infant, it is called as a shaken baby syndrome. Pathogenesis will show there will be slow venous bleed which will be there, and in the CT you are able to appreciate a crescent shaped lesion. You will be able to appreciate a crescent shaped lesion which will cross the suture line. Next that you have is the subarachnoid hemorrhage, that is your SAH. Cause is obviously trauma, then there will be rupture of berry aneurysm, there will be AV malformation. What is the clinical? You will be having sudden severe headache. I have told you earlier also that the person will come to you and will tell you that, doctor, I am having the worst headache of my life. I have never experienced such kind of headache in my entire life, right? And this headache don't subside by taking the medicines also. Okay. In the CSF, you will be able to see xanthoma. What is xanthoma? They are the yellowish discoloration due to the hemoglobin breakdown. There is a breakdown of your hemoglobin pigments. What are the complications that can occur? There will be 𝗲𝗵𝗵𝗆. What is 𝗲𝗵𝗵𝗆? There will be the filling of water that will be there, right? Next that you have is the intracerebral hemorrhage. In the intracerebral hemorrhage, what are the cause? You have trauma, hypertension and contusion. See guys, I'm highlighting the keyword here. The keyword here is the hypertension. If in the case they mention that the person was suffering from hypertension and he basically met with an accident, then he suffered from a hypertension, then you need to understand that this is the case of intracranial hematoma or the intracranial hemorrhage. Okay, the sites are basically frontal, temporal lobes and the basal ganglia. What is the complication that can occur? There will be mass effect and there will be herniation. Okay, so this is very, very important. In the EDH, what you need to remember, it's like a idli shape. Middle meningeal arteries, MMAs are involved. You have lucid intervals. Then the SDH, what you need to remember, shaken baby syndrome you have. Then they cross the suture line at risk, crescent shape in structure. Okay. In this, you need to remember that it basically occurs in the cases of hypertension. Next, you have is the spinal cord trauma. Here, the first thing that you have is the acute spinal cord injury. Now, what happens in the acute spinal cord injury? There will be first hemorrhage. After the hemorrhage, there will be necrosis. Okay, and the symptoms that will occur, there will be flaccid paralysis. Paralysis means the one side of your body or the entire side of your body is getting paralyzed. You are not able to move that also. Okay, there will be loss of bowel and bladder. I think you have seen in the case of your elders, like if you have any elderly in your home, you will be able to see that there is no control. They don't have any sort of control in their bowel and bladder movements, right? So similarly, this also happens because the spinal cord, the brain is not in continuation with the spinal cord. The brain is not in the coordination with the spinal cord, right? So that's what happens. There will be spastic paralysis and hyperreflexia. And Babinski will be positive. And you know what, guys? In newborns, the Babinski is always positive. The clinical syndromes that you have, there will be total loss of motor, there will be total loss of coordination, then there will be sensory functions that will be affected. Then you have something very famous called as your Brown-Sequard syndrome. See this figure? In this, what you are able to appreciate, that one side is getting affected, right? You have the corticospinal tract and you have the spinothalamic tract, and you have read this in your what? Physiology, right? There will be ipsilateral motor paralysis plus loss of vibration, and there will be contralateral loss of pain and temperature. So one thing is only contralateral, that is your pain and temperature, and everything else is ipsilateral. So if they ask you in the MCQ in your university exam, they can ask you that what are the features of Brown-Sequard syndrome, and many times you are just confused, right, that whether it was contralateral or whether it was ipsilateral. So just remember that contralateral is only pain and temperature. You have CPT. Contralateral is only the pain and temperature. Then you have something called as the anterior cord syndrome. What happens here? Here there is loss of motor plus there will be pain and temperature, and then you have the central cord syndrome. Here also there is loss of pain and temperature in your upper limbs, and in the anterior one it was below the lesion, right? What are the complications? If it is an acute case, you will be having the ICP, that is your intracranial pressure. Your intracranial pressure will be raised. And if it is a case of intermediate, then you will be having infections. And if it is a chronic case, you will be having dementia. Okay, you will be having dementia. So this is the summary table, guys. Please go through it very, very well. In the lucid interval is seen in your epidural hematoma. The bridging vein ruptures in your subdural hematoma. The worst headache of your life is seen in subarachnoid hemorrhage. The axonal retraction ball is seen in diffuse axonal injury. Boxer or athlete dementia is seen in the chronic traumatic encephalopathy. Chronic traumatic encephalopathy are basically seen in boxers, athletes. What happens is, here you have a protein called as a tau protein. The tau protein basically gets accumulated and there is a cognitive decline. The patient is not able to take the decision by his or her own, right? Next, basilar skull fracture signs are your CRSF rhinorrhea and your raccoon eyes. Okay, not my eyes, not raccoon eye, but I'm just giving you the example. So this is the question that you have. Let's read the question and solve it together. There is a 25-year-old man, okay, he sustained a head injury. Okay, the question is related to your head injury. He met with a road traffic accident. Now you have to think in terms of trauma. Okay, then he lost consciousness. Okay, briefly, then regained awareness. He was, what he is trying to say, he was first unconscious, then he became conscious. After few hours, he became comatose. Okay. Now I know the sequence somewhere I have read. Let me just read the question forward. In the CT show the biconvex hyperdense lesion. I have come to a conclusion that this is a case of your epidural hematoma. And this interval of yours is called as a lucid interval. So guys, we are just done with this chapter. If you are having any sort of doubt, you can ask me, you can DM me anywhere, right? Just make sure this chapter is cleared with you and it will be asked as a short note. Thank you so much.